God, I just hope Dr. Walter will be able to solve my problem. Good morning, Ma.
Good morning, sir. How can I help you?
Please, I'm here to see Dr. Walter.
What is your name, sir?
My name is Mr. Wilson.
Okay, let me go and inform Dr. Walter. Dr. Walter, good morning.
Good morning, Nurse Ann. How can I help you?
There is a patient by the name, Mr. Wilson, waiting for you.
Okay, let him in.
You can now go in and see Dr. Walter.
Thanks a lot. Good morning, sir. May I know you? Good morning, Dr. Walter. My name is Mr. Wilson. I'm a 60-years-old university lecturer who currently resides in Lagos. What brought you to the hospital today? Doctor, I have been having difficulties passing out urine. When did it start? It started 4 months ago. How did it start? Did the difficulties come all of a sudden, or was it gradual in onset? It started gradually. So what can you tell me about your urination now? Now I usually have this frequent need to urinate. There is increased frequency of urination at night. When I go to urinate, it is usually difficult initiating the urination process. How do you describe your urine stream? Is it weak? Yes, doctor, it's usually weak. Sometimes the urine stream stops and starts again. Also, when I'm done urinating, I usually notice that small volumes of urine still dribbles out. Is there any associated pain while urinating? Yes. Have you noticed blood in your urine while you are urinating? No, doctor. Since the onset of this problem, have you noticed any weight loss? Low back pain? Blood coming out of your anus? Or lower limb weakness? No, doctor. Before the onset of these symptoms, were you involved in any traumatic events that led to an injury to your hip region or genital area? No, doctor. Before these symptoms started, were there any history of urethral discharge? No, doctor. Since the onset of these symptoms, have you noticed that you are now usually excessively thirsty? No, doctor. Are you currently on any drug that helps with urination? No, doctor. Is there anyone in your family who has had these symptoms before? Yes, my elder brother had similar problems. Then the physician attending to him said it was benign prostatic hyperplasia. So doctor, do you think I am having similar issues with my elder brother? Benign prostatic hyperplasia is a possibility, but what I can say for sure is that, from your history, you are having a bladder outlet obstruction. I would need to do some physical examination and investigation to figure out what is causing the bladder outlet obstruction. Doctor, what physical examinations will you do? I will do an abdominal examination and a digital rectal examination. In the digital rectal examination, I will pass my finger into your anus to feel your prostate. Okay, doctor, I'm ready for the physical examination. So doctor, what did you find in the physical examination? Your abdominopelvic examination revealed a distended bladder. The results of your digital rectal examination was suggestive of an enlarged prostate. What does this mean, doctor? It means that the cause of your bladder outlet obstruction is likely to be benign prostatic hyperplasia. Likely? What other things can cause bladder outlet obstruction? Other common causes include cancer of the prostate, urethral stricture, bladder neck pathologies, bladder tumor, bladder calculi, and neurogenic bladder dysfunction. So doctor, does it mean I might have cancer? I strongly doubt. Your history has ruled out the possibility of a cancer. However, I would want you to do some investigations for me. What investigations? Abdominopelvic ultrasound, transrectal ultrasound of the prostate, and prostate-specific antigen test. When you get to the service center, tell the receptionist that I would want your test results to be sent to my system. Okay, doctor.
Good morning, sir. How may I help you?
I have been asked by Dr. Walter to come over here for some investigations.
What investigations?
Abdominopelvic ultrasound, transrectal ultrasound of the prostate, and prostate-specific antigen test. Dr. Walter also requested for the results of the investigations to be sent to his system.
Okay, sir. Mr. Wilson, the results of your investigations are out and as requested by your doctor, has been sent to his system. You can now go back to Dr. Walter's office.
Thank you very much. Good afternoon, Dr. Walter. I was told that the results of my investigations have been sent to you. Yes, I have looked at it and it strongly supports my diagnosis of benign prostatic hyperplasia, which is treatable. Thank God, at least it's not cancer. Yes, it's not cancer, but your investigations also revealed that your prostate has grown so large, to the extent that it's almost occluding your prostatic urethra. What does this mean? It means you would require surgery. Surgery? You don't need to cry, sir. I will personally do the surgery. It will be a successful surgery. Okay, doctor, I guess I will go and get myself ready for the surgery. No problems, sir. To follow up on Mr. Wilson's surgery, including his pre-op and post-op assessments, please click on the subscribe button on the right and on the like button on the left.